Can you describe what bipolar is?
Bipolar is, a psychological condition, mental health problem, marked by two, typically marked by two symptoms: depression, period of depression. Everyone kind of knows what depression is, and then kind of there's a converse, manic, stage that, sometimes they alternate between rather quickly. Sometimes it's more of a subtle, shift. And so, depression's, low energy, eating too much, not eating enough, sleep problems, and, on the flip side of that is the manic symptoms, very goal-driven behavior, sometimes very self-destructive behavior, spending too much, X amount of hypersexuality, just really kind of goal-focused, and a lack of sleep, very difficult to go to sleep sometimes. People will report 1 or 2 hours of sleep and waking up and feeling, well rested.
And what are there variations, like the spectrum of autism takes you from autism to very high functioning Asperger's? Is that true with bipolar? I mean, what can it look like for a loved one who is trying to work with someone who has bipolar, and how can someone self-identify?
That's a very difficult, issue. Oftentimes, I often notice bipolar being a little bit over-diagnosed, and when you kind of sit down and you talk with people, I'll give you an example. I met with this teenage girl, probably 15 or 16, maybe 17, one time, and she came in for a psych eval. Parents thought she was ADHD. She had a previous bipolar diagnosis. And when I kind of sat down with her and I talked to her, about meeting with her psychiatrist, she described it like as a 15-minute, appointment. She met with this guy one time, kind of told her behavior, kind of just being a mouthy teen, probably acting out, and where that was kind of pathologized, that kind of teenage rebellion. And then I started talking to her more, and she had had been sexually assaulted, and, or didn't realize she was pregnant from that, and parents made her carry, very conservative family, parents made her, insisted she carry the pregnancy to full term. Child was born with like a brain stem, and the grandparents had taken over guardianship for her, but she was still in the house confronted with this, all the time. And, we start talking about trauma and, what that looks like. And I could tell maybe the parent wanted it to be bipolar because the trauma part of it just didn't seem, to kind of fit into that, ideal, idea of what a family should look like. This doesn't happen to us, kind of thing. So I think, sometimes bipolar is a little bit more safer for a lot of people to kind of wrap their head around.
And so intermittent explosive disorder, ADHD, ADD, bipolar, these can all be misdiagnosed from what is the behavior that is the product of trauma.
Mm-hmm. Yeah, and especially because part of the, symptoms of trauma is dissociation, withdrawal. So, sometimes you kind of, I'll meet with someone for a couple months and then they start telling me this trauma history that they had. And it wasn't until that relationship was there that they finally felt safe, to open up to me about it. And so, they're exhibiting symptoms that look like ADHD and, you know, hyperactivity, you know, that type of stuff.
Always got to be moving,
Yeah.
can't stay focused.
And, you know, that could just be anxiety-driven trauma, you know. You get that diagnosis. And then what often happens, so then someone gets that diagnosis, they get the bipolar diagnosis, and then finally the trauma stuff comes out. Then it's all on there. It never gets weeded off, really. So in the file, you know, they have all these book-stacked diagnoses, and, you know, they needed to be ruled out. You know, a lot of people don't put out the rule out, you know, look for this, look for that, you know, when they do the
And so then that person
evaluation.
takes on that label.
Yeah, yeah.
And so sometimes diagnosing people can be a little bit scary because then they become that box
Mm-hmm.
and not who they are.
Yeah, yeah, yeah. And then you add multiple labels on top of that, and it's just, you know, kind of the hopelessness kind of sets in, you know, at that point, and helplessness.
So what would you recommend in these cases? That people go back for second opinions? That they what would you?
You just gotta have to be a savvy, you know, patient. You have to, you know, sometimes it's just the authority of the person standing across from you, you know, really drives it home, and you kind of have to, well, was it this or was it that? And I don't think we are, as a culture in America, at that point where we're conscious enough, you know, of, you know, mental health stuff. I think people watch House and, you know, Nurse Jackie and other TV shows, and then people are pretty savvy, you know, about, you know, their physical health and, you know, how to rule stuff out, and if it's not this, not that. I really don't think we're there with the mental health stuff, and people don't know, you know, how to question and, you know, if it's not this and not that. Because, you know, oftentimes I'll hear people like, well, I got depression and bipolar. And I kind of have to set them back. I'm like, you know, that saying, like, it's raining and sleeting outside. You know, sleet is rain and snow, so that you're implying that there's already rain into the mix. So when you say bipolar, that's depression and anxiety. You're already implying that, you know, depression, you know, is in the mix. And then they kind of start, oh, okay. And, you know, sometimes they're kind of resistant to it because they've already been telling people this for, you know, all these years. And
It's their narrative already.
yeah, and then anytime someone has to change their narrative, you know, it's harder to go back and save face and be like, well, actually, you know, I got a second opinion and this is what it was. And, you know, there is that little bit of Munchausen's, you know, kind of people like the label and the kind of the attention it gets. And if you kind of have to change or whatever, you've already kind of put your emotional investment into it, and it's hard to, you know, go back.
Got that.